Okay, so welcome to everybody. This is our second point of care testing operator and training and competency presentation. Julie was unable to be with us today, so I'll be presenting. My name's Kate Astle and I'm a coordinator based in Dubbo. So our agenda today, what we'll be going over is what is changing and why, what the new program looks like, how we'll be tracking performance, the communication around what we'll be doing, what happens if an operator is not compliant, important timelines, and then available resources. So firstly, I would like to acknowledge the traditional custodians of the lands which we work and pay our respects to ancestors, elders, past and present. So what is changing and why? What is changing is the way that we recertify operators on the point of care testing devices. And the reason why we're changing this is because of the number of operators we have within the state that require recertification. So we'll be moving towards monitoring usage and errors rather than a standing timeline. So the program, nothing will change initially. So when an operator first is trained on a device, it'll need to be face-to-face. A competency assessment will be filled out at this time, either by a super user, point of care coordinator or a vendor, and then access will be granted to the device. Each month, the point of care coordinators send out reports. Within these reports, we are monitoring operators at each facility based on their errors. If they appear in these reports, they will be sent a notification. And then annually, we will be reviewing the usage over 12 months. And if an operator has had above the acceptable error rate, then they will require retraining or will be locked out. So the reports that we have will be generated on the 1st of May. They'll be sent to the super users. And then targeted training can happen over May and June. And then if there are any operators that are not trained within that time period, they will be locked out at the end of June. So the recertification approach, the monthly and 3-monthly review, so this will be up to the point of care coordinators to do. These notifications will be sent to the super users. If an operator has several monthly notifications over a 3-monthly period, then retraining may be required. Otherwise, it'll be reviewed annually. There are 4 different types of categories operators can fall into, which is automatic recertification. So enough testing has been performed over 12 months with minimal error. Greater than acceptable error, meaning that they'll require retraining. There'll be a certain number of staff who do not perform enough testing for recertification and they may require retraining. And then there'll be staff that have performed no tests. This is a sample of the monthly notification. So an email will be sent out to the person who has had the errors along with the super users copied in. On our error information sheet, there are boxes in the corners. This will be selected based on what error was incurred over the month. There are also corrective actions in each of the boxes. So monthly, it's just a notification, just for them to have a bit of a read to see if they can correct their technique to reduce the errors. 3-monthly, so if they've received several notifications and they're consistently having errors, then they will need to be retrained. This retraining will be performed by super users, coordinators, lab staff, or vendors. So for the 3-monthly action, we have our competency form as listed here. There is a section for targeted training. So this session may not take as long as an initial training. You might just go over the technique of loading a cartridge. Annually, so a list of operators will be provided to the super users that will require targeted retraining. The training records will be kept by the coordinators. So once the training has been completed, the forms will need to be sent back to the coordinators. And then operators not completing training within the time frame will be locked out and notified. So our recertification timeline, so our reports will be generated on the 1st of May by the coordinators. Don't expect the reports to be sent to the super users on the 1st of May, but during the month of May, the reports will start to get sent out to the super users. Then for the remainder of May and June, the targeted training can occur. And then the 1st of July will be the cut-off for lockout. If you've got staff who are on extended leave or who have not met the timeline that training is scheduled, you can coordinate that with your point of care coordinator in terms of lockout. And my computer is frozen. There we go. So the resources we have available, there are several forms and reports in your lime green folders. There we have a point of care notice to operators that can be laminated and put at the device. And then we have got the monthly and annual reports, which will be emailed to the super users. And then we have the webinar recordings and presentations. So these are kept on the point of care website. So in this month's monthly reports, I think the link will be sent for the recent webinars with some more information. And now we are up to questions. So I'm going to unmute everybody. Does anyone have any questions?
The point of care website and the resources there, are we able to just access those normally? Like we don't need a PIN number or anything like that?
Yeah, that's correct. So I'll show you. So from the pathology website, if you can all see my screen, we have clinical services and point of care testing. So if you click on the point of care testing tab, you'll then come to our homepage and there is a resources tab. So from here we've got information, so device materials, information for super users, and then our webinars.
The initial pathology website.
URL, yep.
How do we get to that one? Is that just new stuff?
We can send that out to you guys, but it's just www.pathology.health.newsouthwales.gov.au. We'll include it in the meeting invitation, and then it should be sent out. We'll include it in the monthly report.
Great, thank you.
Any other questions around the recertification program?
Hi, it's Katrina from Trundle, Tullamore and Tottenham.
Hi, Katrina.
How you doing? Just a couple of questions, I suppose, from me, from being the health service manager. I've been a super user and, you know, the one who does the testings when, you know, the staff can't do it or there's a problem. I probably don't do a whole heap in my 12-month period, so I could potentially be the one who gets blocked out. Is that what you're telling me?
So the number of tests required is 10 over 12 months. So, and that can be, so if you move around between facilities, that can count from any facility. It doesn't have to be on the one device. If you haven't performed 10 tests and you have had no errors, then it'll be up to your coordinator to decide retraining. Otherwise, if you've performed 10 tests with no errors, you'll just automatically recertify. So monthly QC also counts as testing.
Okay, cool.
So if you think that there are staff at risk of not performing enough testing at your facility and you want to get them to run the controls for April, might be advised.
Yeah, no worries, thank you.
Yeah, QAPs also count towards the test as well.
I've done a couple of those in the 12-month period, but I can't guarantee that I've done 10. Do you know what I mean? Like I might have done 3. But anyway, we'll just wait and see if I get kicked off or not.
Katrina, it's Rupert Changi. I agree, the small sites, the staff are going to struggle to get 10 tests a year sometimes. Absolutely,
Ruth. And especially like you and me being managers of the staff that we manage, it's difficult for us, and that's what my concern is, being the super user, we're the ones that they ring up and say, what are we doing wrong? But yet if we're going to be locked out as well, or if we're here, it's going to be really difficult. Because like here in Trundle alone, that's where I'm working out of today, there's 2 super users.
Yeah, I think the point to note, guys, is that you're going to get a good 6 weeks, I'd say, notice before any lockout. We certainly won't lock you out before advising. So it's not a case of, you haven't met this, you're going to get locked out. So once the report goes out, we'll have a couple of months before the formal lockout. But certainly if you've got concerns, discuss it with your coordinator. Whether we can do some, training in the interim. As long as we're happy to, the coordinators are happy that, you've got confidence, that will be ongoing. So, we're not certainly, we're certainly not, in the thing of making things more difficult or trying to lock people out. It's just we do need some sort of way for certification to make sure people are competent as an ANA requirement. The heady online training wasn't working so great, so we've gone to this. So the hope is more and more people use it and get familiar with the devices. It's going to become less and less of an issue, and the monthly feedback. So, but certainly if you've got any concerns after the report, just discuss it with your coordinator so that we're not getting into a situation where people are being locked out of the devices when they are competent.
Yeah, as I say, it's just in our small facilities, Brett, more so that they're not actually probably getting to do, all of the tests that come in. Trundle alone, potentially,
definitely,
staff, but they wouldn't, half of them wouldn't have done a test, but they yet would know if they had to.
Yeah, and we're in the same situation with labs that, all our lab guys, they're not in a clinical setting, so they're not doing the patient tests. So we're in a similar situation with the guys in the lab as well. So certainly something we're aware of. But any concerns, just have a chat with us.
No worries, thank you.
So it's Brian at Geraldred. When we train somebody, we use the QC liquid, but I was just wondering, is there any way that there is another, I don't know if we did that when we did Superusers training or not, but is there another liquid that we could use, and then we could actually train staff and check everyone's competency at the same time? Like we could work through it, and then we would potentially miss out on, we potentially wouldn't have this problem.
Brett, did you want to answer that one?
Yeah, it's...
Or is that a silly idea?
No, it's not a silly idea, Freen. Yeah.
I think what I'd recommend is actually performing the monthly QC rather than just using the liquid and cartridges to perform testing. So you can do both at the same time, then you may have more operators who are able to provide support with the quality testing monthly.
Yeah, but when you get when you get a new staff member, you've already done the monthly QC.
Yep, so you can use the fluid and use the 8/8 as the training ID, and that counts as testing.
Yeah,
we're just wondering about a different fluid, if there's something that we can use to try and get everybody checked off and
we could put them through if we had a different testing fluid.
And you could always keep the QC material, just stick whatever's left in the vial and just put it aside, maybe put some sticky tape over it and use that later in the month if you have any training.
What a lot of my facilities do is they put the fluid into a heparinized tube, and then they just keep the heparinized tube labelled as training patient.
Okay.
So that's not going to come up as an error if it's done like that fluid, if it's a certain time period that it's been out of its little vial, it won't come up as an error, would it?
No, it won't come up as an error, as you know. So the longer that the fluid is exposed to air, the oxygen increases. you're not running it as a quality control though, you're running it as a patient. And so the quality control fluid can still be used for patient testing after it's been opened, and it will still give results.
Yeah, you're just going to have a high oxygen and
low CO2
and a high, probably a high pH. So
yeah.
And anything like that doesn't come in on the error report, it's separated off?
No, the errors we're looking at are the overfilled, underfilled, clot, and the pre-burst, which is a handling error where they've, might have gripped the middle of the cartridge too hard and broken the fluid. So they're the errors that we're looking at for the iStat. So certainly not, high results or anything like that. That's not an operator error.
So this is our error information sheet. So you can see we've got underfilled, overfilled, blood clotting. So the QC material won't clot, and then we've got the quality control pouch on cartridges burst. So that's the pre-burst error where you pop the calibration pouch beforehand. So they're the 4 types of errors we're looking at for iStat. And so using expired or old QC material, if they're handling the cartridge correctly, shouldn't error.
Okay, perhaps I should have said it more specifically. If I'm training someone and they do one of these 4 errors, is that cut out of the error report?
So if you're training someone and they have an error, it will appear in the error report.
No, but when they're training, they may not have a
ID
access into the systems yet, so they would be using Fran's ID. So we'll have a look at that. Certainly, as if you put it in as an 8.8 and there's errors, then we know they're training errors.
Yeah, good.
A lot of the time as well, I'll email my super users and say, have you performed much training this month? And they'll be like, oh yeah, we trained this person, and they had a few errors with my ID. And so you can go back and see when the errors were, and they were on the days they were performing the training. So obviously the super user does not require retraining if they're training staff and they have an error under their ID. So that's just that's up to your coordinator.
Yeah, sounds good. Thank you.
That's okay. Are there any other questions? Okay, lovely. If there are no other questions, then that was all that was included in today's webinar. The first recording is also going to be posted on the website, as I think this one will as well. I'll speak to Julie afterwards. So otherwise, if you've got any further questions, you can email Julie or you can email your point of care coordinator, and then hopefully see the report start trickling through in May.
Thanks very much.
Thanks, Kate.
Right.
Thanks for attending, everyone. Have a great day.
You too.